Much like lower back pain, sciatica, hip, and knee pain can stem from a wide range of issues. Follow these easy exercises with the backmate to promote recovery and keep the pain from returning.
We're going to refer to these collectively as the hip external rotators. You have your gluteus maximus, medius, minimus, as well as some deeper muscles in there, one of which being the piriformis. We're going to be able to hit all of those muscles on the backmate. We're going to obviously go on the other side for demonstrative purposes. We're going to find where our glutes are by little bony prominence, our little greater trochanter. We're going to go just behind that, and we're going to roll around just into that area there. So Janelle, go ahead and get tight on that. So press the backmate again. It's a trigger point, but now you can allow a little bit of rolling there because that's a pretty expansive area, rolling from the greater troch all the way into the bulk of the glute there. Put enough pressure again. This will release some of that deep pressure you have. Again, piriformis gets tight in a lot of people. That contributes to a lot of sciatica type presentations. You also have the glutes that can limit the rotation of the hip as well. So by addressing this area, open up the hips, decrease some of that stress on the low back. And here we're going to instruct you in how to release the iliopsoas as well as the tensor fascia lata, or the TFL, and then some of the other hip flexors that sit on the anterior part of the hip. As Janelle gets into this position here, she's going to position herself in more of a stride lunge position here. We're getting the right hip here. The left foot is going to be forward. By being in this stride position here, you can see she's actually put her hip flexors a little bit on stretch. And what she's going to do here is just lean into the ball. It's going to be a deep feeling of almost like a little ache, but that's getting into those hip flexors. Those hip flexors again are attaching onto the lumbar spine and pelvis. We're going to go ahead and let those release. Cannot forget about the calves. The calves are working every step that we take. These things are having to do a lot of work, expending a lot of energy. They get really tight throughout the day. Then you go and sleep on them and your foot is in this position. So those things are gonna get very tight throughout the night and the day. So Achilles,